Is it safe to take sleeping pills? Let's find out. I'm Dr. Nisha Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And if you don't already have this, I would recommend that you go ahead and grab my free holistic sleep guide. The guide is available on my website at intrabalance.com/sleep guide, and the link is also in the video description. There are a few different broad categories of sleeping pills. The Z drugs or the Z drugs. These are medications like Ambien, Lunesta, Sonata. Their generic names typically begin with Z or Z. That's why they're called the Z drugs. There are also benzodiazepines, so these are medications like Klonopin, Ativan, Xanax, and so forth. Then there's also over-the-counter sleep aids, so these are things like anything that has PM, so like Tylenol PM or Z-Quil, and these are usually more Benadryl or diphenhydramine-based medications. Z drugs are the most commonly prescribed hypnotic agents worldwide, and in the US, prescriptions of these exceed over $285 million. This is a big business. Whatever type of sleeping pill you're taking, whether it's a Z drug, benzodiazepine, or an over-the-counter Benadryl-based medication, the thing is that they're not meant for long-term use. These are intended to be used only intermittently or only for about 2 weeks at a time. They do have interactions with other medications and substances. So if you're taking other medications or if you're drinking alcohol, you want to check with your doctor to make sure that it's safe to be taking these medications in conjunction. As I mentioned, these medications are not meant to be used for long-term issues with sleep. If you start taking them every night, you're going to need to take them every night. There's a thing called rebound insomnia, which is insomnia that happens when you stop taking the medication. So one of the great ironies of taking these medications is that they can actually start to cause the very issues that you're trying to treat. Using sleeping pills can also cause a hangover effect. So you can feel groggy and heavy and fatigued and lethargic or even nauseous after taking sleeping pills. Taking these pills can also cause other specific issues. They're associated with a 5 times higher risk of memory and concentration problems, 4 times increased risk of daytime sleepiness and fatigue, twice as high of a risk of falling and breaking bones, and then twice as high of a risk of getting into a car accident. Another side effect of these medications, specifically medications like Ambien, is something called a parasomnia. A parasomnia is a behavior that occurs during your sleep. It's a complex behavior. So these include things like sleepwalking, sleep eating, and even sleep driving. I've seen people in my practice that would get up in the middle of the night after taking something like an Ambien, and they would eat like an entire pizza and not even know that they're doing it. And the next morning they would wake up and there would be an empty pizza box and crumbs everywhere, and they had no recollection of it. These very complex behaviors can happen on these medications. And in fact, sometimes these can actually be quite dangerous behaviors. In the example of sleep driving, or people can fall down the stairs, they can get into accidents, and there actually have been cases of death reported because of this particular side effect. Other issues to be aware of with these medications are tolerance and dependence. With tolerance, what can happen is that you start to need higher doses of the medication over time in order to get the same effect. Your body can also become dependent on the medication, resulting in withdrawal symptoms if you miss a dose or if you try to stop the medication. It's not recommended to try to stop these medications cold turkey, because that actually can be pretty dangerous, and it can even lead to very serious withdrawal symptoms like seizures in some cases. So you always want to reduce or taper the medication under the guidance of a licensed healthcare practitioner. Are these medications all bad? Should you never use them? It's not that these medications are inherently good or bad. They're simply a tool. They're a tool that we can use appropriately in certain situations. So if you're going through a situational stressor, or maybe you're traveling, or you have, some big event the next day where you want to make sure that you're able to sleep, it's perfectly okay to use these medications once in a while, again, under the guidance of your healthcare practitioner. Like with any tool though, it's how we use it that's important, and what we're using it for that's important. If you're using the wrong tool for the wrong job, or if you're using the tool inappropriately, that's where you run into problems. Therefore, one of the problems with using sleep aids long term is they don't actually get to the root cause of the sleep issue. And then once you stop the drug, the problem hasn't been resolved, so the sleep issues come back. Okay, then what do you do instead of taking a sleeping pill if you're not sleeping well? The first thing is to identify identify the underlying cause. In some cases, it could be a medical issue or even a sleep issue like sleep apnea. Circadian rhythm or body clock misalignment is a common cause that I see all the time. I see a lot of people coming to me who are taking sleep aids or prescribed sleep aids for insomnia when actually the issue was a circadian rhythm disorder that can be treated without medication. Other issues to take into consideration are anxiety and depression, thyroid issues. There's a whole litany of medical issues that can cause sleeping problems. Certain medications can also cause sleep issues. So it's really important that you talk to your primary care physician or your psychiatrist or whoever you're seeing to help you identify what the underlying cause may be. Another aspect of sleep to take into consideration is your mindset and regulating your nervous system. If you're experiencing anxiety and frustration and stress about sleep itself, that is going to feed into the vicious cycle of insomnia. Sleeping pills are not going to help you overcome that vicious cycle that becomes a self-perpetuating thing. So if that is a situation that you're experiencing, you may benefit from cognitive behavioral therapy for insomnia. And if you haven't already seen it, I recommend that you go and check out my video on CBTI or cognitive behavioral therapy for insomnia. A few simple things that can be helpful to get a better night's sleep are to stay on a regular schedule. Get up at the same time every day, get bright light in the morning, eat your meals at the same time every day, and exercise at the same time every day. This will help to regulate your body clock and get your circadian rhythm into alignment. Another tip is to not spend too much time in bed. Oftentimes the tendency is to spend more time in bed with the hopes that we're going to get more sleep if you're not sleeping well. But if you're experiencing anxiety and frustration and stress about sleep, this can actually make things worse. If you've been using sleep aids for a long time, the idea of coming off of them can be really scary and really overwhelming. And it can also feel kind of nebulous, like you're not really sure what you're going to do instead. If that is the case for you, then talk to your primary care physician or a sleep specialist or get a referral to one to look at a plan to help you get off medication and to address the root cause so that you can get off the medication safely and effectively. And it can be done. Remember, there is no one quick fix. If you're not sleeping well, it takes multiple tweaks over time to get good quality sleep. In the meantime, go ahead and subscribe to my channel so you can learn more about upgrading your sleep and well-being.